Okay, so I'll start the session now, and anyone else who wants to join can join as I'm going through the slides, and then if they want to catch up, they can watch the recording or the slides that you'll get after this session. So this session is on how to write your personal statement. So I'll be first of all going through what should you include in a personal statement, and then talking about how to structure your personal statement as well. Okay. So before we start, just a little bit about Six Minutes, the company that I'm working with. It was created by medical students for other medical students, and over the past 6 years, we've taught over 10,000 students across the country, and sometimes we also get people from different countries as well who want to study medicine in the UK who we help with. So the kind of events we run are these surgery webinars, like the ones I'm running today. And that just gives you a little bit of insight into different aspects of medicine. We also offer support on UCAT and BMAT, which you can see in this screenshot here of all the different types of tuition or like interview courses and large group courses that we offer. We also offer interview preparation and help with your personal statements and help with your UCAT as well. Okay. So a little bit about me. I'm a fourth year medical student. I study at Bristol. Currently I'm doing a standalone year called an intercalation year, where you can either do a bachelor's or a master's degree on a medical topic that you find really interesting. So that's what I'm doing at the moment. I'm really passionate about teaching, always have been, which is why I get involved in these kinds of sessions, and I'm quite interested in surgery at the moment as well. So that's a little bit about me. So what are we actually going to do for the session today? So first of all, I'll take you through why we actually write a personal statement, what's the importance of a personal statement, and then how to structure your personal statement and what should be included. And then generally just some tips and tricks on how to write a personal statement, and then my personal tips. And then I'll give you some useful resources which you can refer back to when you're writing your personal statement as well. So before the session starts, just some housekeeping. Just make sure you're muted during the session to avoid any disruptions while I'm going through the slides. I'll try to make the sessions as interactive as possible. So I've got slides where I'll ask certain questions. They'll be quite simple questions, and it's just for you to also get involved in the chat box, where you can type your answers down, and then we can discuss what different people think, and also use the chat box to ask questions, and I'll try my best to answer them either as we go along, as I go through the slides, or at the end of the session where I have a little Q&A section. Okay. So if we're happy with all of that, this is the first question. So if you want to type your answers in the chat box, you can just write 1, 2, 3, or 4. So on a scale of 1 to 4, how much do you know about writing personal statements? So 1 is no knowledge at all at the moment. 2 is some knowledge. 3, you know a lot about it, but you want to find out more. And 4, you're confident in writing personal statements. So if you could just type in 1, 2, 3, or 4. I always have these kinds of slides just to, and I'll ask the same question at the end of the session, and it will just be a bit of feedback for me on how well I've taught the session, but also for you to see how much you've learned over this 1 hour session as well. So most people are saying either 2s or 3s. Okay, that's good. So that's what we're here for this session, to just learn more about it and try and understand how to structure your personal statement, which is great. Moving on to the next slide. So the main things I'm trying to get across in this session is for you to understand the purpose of a personal statement, and also how to write a powerful personal statement. So those are the 2 main things we're covering today. So second question, if again you want to type in the chat. So what do you guys think a personal statement is? Just in general terms, what do you think it is? Okay, someone said selling yourself to the university. Yeah, I like that answer. Anybody else? Any other suggestions of what a personal statement is? So Phil said, a summary of your skills, achievements, and why you want a certain position. Yeah, perfect. So it's personal statements are very, very similar to when you're applying for a job and you're putting it on your, you know, showcasing your CV, basically, similar to that. But it's a statement about who you are, why you want to do this course, that kind of thing. So Elizabeth said an elevator pitch. So you're hooking the admissions team in and at the same time take it as an opportunity to tell them all about yourself. Yeah, that's really good. That's a really good way of thinking about it. And then Bilal has said detailed reasons to why you want to do the degree course. Yep. So you're answering the question, why do you want to study medicine? But you're also talking about how your personality fits into medicine. Maggie said to tell how much you're prepared for the course. Yes. And then to show our enthusiasm in the subject in written form. Yeah, perfect. All of these answers are really good. So in general, to summarize everything that you guys have said, a personal statement is basically telling the interviewers this is who I am and also saying this is why I want to study medicine. So it's a brief summary about who you are and just more of the technical things. It's 4,000 characters. So characters meaning it includes all the spaces in between the words, the punctuation marks and all of that. So you do have a limited number of words in which you need to tell them who you are, why you want to study medicine, what work experience have you done, your hobbies, that kind of stuff. So you need to be really clever with the way you phrase your sentences so that you get the most out of that personal statement and you get all your points across. So it's your one chance to describe who you are before they see you at interview or decide whether they want to give you an interview. And it's also a chance to describe how you developed an interest in medicine. So did you do any types of work experience or volunteering that made you interested in medicine? Or did you like the sciences, for example, and which aspect of the sciences did you like? And then you're also saying why you would be a good candidate for medicine and what motivated you to study this degree. And then a short paragraph of what you do outside of academics as well. So things like your hobbies or things that you do outside of medical related stuff. The reason why they want to know that is because they want to see if you're a well-rounded individual, and if you did get into medicine, they're trying to think in their head, would you be able to manage the stress and the workload, and do you have a good enough work-life balance? So they're trying to see if you have good ways to cope with lots of work, basically. So that's why they want to know what you do outside of academics as well. And it also shows your ability to use lots of different transferable skills. So for example, if you play in a sports team, your teamwork and communication skills there can then be transferred into medical scenarios. So they want to see that as well. So what's the purpose of a personal statement? So it's to demonstrate your interest in medicine and for you to demonstrate skills that would make you a good doctor in the future, and also for you to demonstrate skills that would help you maintain a good work-life balance, as I mentioned before. It also helps help the interviewers understand your personality. So what do interviewers look for in your personal statement or the admissions team? They want to see if you've explored a medical career properly. So did you just one day decide you want to do medicine, or did you actually think it through properly? And then, you need to sort of paint a story. So you need to say, for example, initially I really liked biology and I liked this aspect of biology. So then I took up some work experience. And then during my work experience, I learned X, Y, and Z. And then because of all of that, I developed an interest in medicine and I wanted to pursue this career. So they want to see you sort of say a brief story about how you came to be interested in medicine. And then they want you to reflect on any work experiences you've done. And they want to see through your work experience, do you understand what it means to be a doctor? Do you understand that there's a lot of difficult scenarios that you'll have to deal with as well? And then they want to see, are you a well-rounded individual? And they want to see if you have to go with that interest outside of academics. So next question, so if you guys want to type in the chat again. So what do you think you should include in a personal statement? So 1, just motivation for medicine, 2, hobbies and extracurriculars, 3, work experience, or 4, all of the above. So just type your answers in the chat, just put the numbers 1, 2, 3, or 4. Okay, lots of people have said 4, which is good. So yeah, so in a personal statement, it has to be balanced. It has to have a little bit of everything. So motivation for medicine and work experience, probably your biggest focus. They'll be the paragraphs which take the most amount of space, whereas your hobbies and extracurriculars might be the second to last paragraph before your conclusion, and it will just be talking about what other things you do outside of medicine. But the first 2 things would be motivation for medicine, and to show your motivation for medicine, what work experiences you've done. And then the final bit will be hobbies, and then you'll have your concluding statement. Okay, so how do we actually structure the personal statement? It can be really daunting to start with, because for many of you, it may be the first time you're writing a personal statement or writing a CV type thing where you're showcasing your skills, and also trying to persuade them to give you sort of an interview compared to other candidates that you might be competing against. Oh, someone's asked a question, so just 1 second. Extracurricular activities other than academics doesn't help in medical applications, is that true? I don't think so. I think it's important to put your extracurricular activities, but like I said, not use too many words or too many sentences to talk about your extracurriculars. Maybe 2 to 3 sentences to discuss, I play in this sports team, or I play a musical instrument, and I've done that for the past 5 years, and through that I've learned like transferable skills like communication, teamwork, organizational resilience, those kind of qualities, which then you can link back to how you would use that in medicine, or why those skills are important in medicine. I personally would recommend students to talk about their hobbies, because it shows you're a well-rounded individual. Because if you only have stuff on medicine, then I think they don't get to know you as a person as well, because every other student will have very, very similar things about what sort of work experience they've done, what sort of volunteering they've done. What sets you apart is your personality, which I think sometimes is shown through your hobbies as well, and not just your motivation for medicine, if that makes sense. Okay, so hopefully that answered your question. So structuring the personal statement. So it's usually sort of a cyclical approach, the way I think about it. First, you'll start off with this box, so motivation for medicine, where you'll be talking about, first you'll start off with a summarizing statement, where you'll be talking about why you want to do medicine and why you think you would be a good doctor. So just the first paragraph will cover that, and it will be a few summarizing statements. Then you would move on to why, what made you interested in medicine in the beginning. So what academics, was it a certain biology topic that you learned, or, a personal experience you had as a child, or a family member who had an experience within healthcare that made you interested in medicine? What was it that got you interested? So that covers academics and personal experience. Then after that, what sort of work experience have you done? Did you do online work experience, GP experience, hospital experience, or volunteering? Or did you just have non-medical part-time work, but then you were able to use those transferable skills for medicine? So what sort of work experience have you done, and how did that make you interested in medicine? And then after you talk about this, so this will probably take about 2 to 3 paragraphs on its own. And then finally, your last paragraph will be interests outside of medicine. So what extracurriculars do you do? How did they give you or help you develop transferable skills, which you can then use in medicine? And then your final concluding statement will go back in a circle to what you were talking about in the beginning. And you're trying to re-emphasize why you want to study medicine. So your last statement, again, would summarize everything that you've said in your previous paragraphs. And then you would say, so because of all the reasons I've talked about, that's why I think I'd be a good doctor, and that's why would like to pursue a career in medicine, or something like that as an ending sentence. Okay, so before I move on to the next interactive session, there are a few questions. So Bilal has said, what's more important, personal statement or school reference? I think personal statement. References are important, yes, because it helps the admissions team understand what kind of a person you are based on, what your teachers think. But I think personally, the personal statement will tell more because it will show what sort of work experiences you've done and how you've reflected on them. So I think personal statement would have more weighting. Kieran is asking how many work experience reflections are needed. Depends. So I would pick about, in my personal statement, I had 1 to 2 examples, but with those 1 to 2 examples, I did a lot of reflection, and I sort of discussed what skills I learned through those work experiences, and how I can use that if they offer me a place in medicine. So not many, but the ones you choose should be really like ones that stand out quite a lot and you can discuss in a lot of depth. And then Harry said, is there any alternatives for work experience if we don't get the chance to get one? Yes. So I did a session before on work experience, and what you can do is online work experience. So Brighton and Sussex Medical School do an online work experience, which you can do. There's also a virtual GP work experience you can do. And if you don't have medical work experience, it doesn't matter. You can do volunteering in your local community, or anything where you're working with people. So you're developing the communication and transferable skills, because that's what you're going to be doing as a doctor. You're going to be working with people and you're going to be developing those communication skills. So that's kind of what you need to reflect on. It doesn't have to be medical work experience. Hopefully that helps answer all your questions. So I'll answer the remaining questions later on in the Q&A session, just so we don't run out of time. But for now, you guys can keep adding the questions. I'll just address them later on. So if you guys could type in the chat, what do you think you should discuss in the introduction of a personal statement? Just a few suggestions. Yeah, so Kieran said motivations for medicine. Yeah, that's perfect. So I'll probably, as I said before, be one of your first paragraphs. Anything else? Basic qualities of a doctor, yes. More specifically, I would say qualities of a good doctor, and if you've observed any of those qualities in your work experience. Elizabeth says, try a hook if you have enough time. An anecdote, yeah, I think a hook is a really good idea because it personalizes, well, it's called a personal statement, isn't it? It's because it's personal to you and your experiences. So if you have your own anecdote or personal work experience, that makes it more unique and stands out against other applicants. Heba says, a few sentences on how you were introduced into medicine. Yeah, perfect. So all of these suggestions are really, really good. Right, so yeah, so the introduction, just a little bit about who you are and why you want to study medicine, but as a summary, not writing too much about it because that's what your remaining paragraphs are going to discuss anyway. So just as a summarizing statement, I'd say about 2 to 3 sentences covering these 2 aspects. And then why do you wish to study medicine is the next, the main part of the question that you need to answer. The really, really common answers that I see in a lot of personal statements, because I do also mark personal statements during September, October time. What I've commonly seen with students is the answer to this question is they love the sciences or had a personal experience within the healthcare system, or they've had a family member who suffered from an illness which made them then be interested in medicine, or they want to help people. All of these answers are fine, but because they're quite generic. So if you just say this is a statement and then don't discuss those personal examples in depth, it doesn't make your application stand out more. So to help you make it stand out more, what you can do is, if you're going to talk about the sciences, if that's what motivated you to study medicine, then you need to expand on that and talk about how those scientific concepts made you interested in medicine. So was it that because you enjoyed applying those scientific concepts to real people to treat them? Is that what interested you in medicine? And if you have had a personal experience with healthcare, you need to go into a little bit more depth and say, how did that experience shape you? And why did that experience particularly strike you and make you interested in pursuing a medical career? If it was something to do with a family member who suffered from an illness, how did that inspire you to study medicine? And if it's because you want to help people, why is helping people important to you over other aspects? Because a follow-up sort of question that the admissions team might be thinking about is, well, in nursing or, you know, other sort of healthcare roles other than medicine and becoming a doctor, also is involved with helping people. So why do you want to study medicine and become a doctor specifically is what they'll be thinking. So you need to be very, very specific with your answers. Okay. So next question, why should you discuss work experience in your personal statement? Why do you think it's important to do that? If you want to, again, type in the group chat. So someone said, how well you reflected and learnt everything. Yes, perfect. Shows initiative and that you know the realities of medicine. Yeah, I think you touched on a really good point there, both of you. So reflection, they want to see if you're able to reflect on the experiences and what you learned from it, and also understanding the realities of what it's actually like to be a doctor. It's not always going to be about you know, doing well and saving people's lives or treating them and, you know, changing their lives for the better. Some days you can have really difficult days where you might not be able, or you might have to deal with difficult ethical dilemmas. So understanding the realities of being a doctor is important, and also shows your commitment, what you learn from it, yes, and then how you can relate it. What we'll be doing in the future if you become a doctor. Yeah, perfect. And someone else said, show our involvement, dedication to the subject. Yeah, perfect. All of those answers are really good. So in the session, I did a session before on getting different types of work experience and then writing reflection diaries. So I'll go over that session again because it's important specifically for the personal statement. So what a reflection diary is when you're on your work experience placements, whatever they may be, whether they're medical or non-medical or whether they're volunteering work experiences, it doesn't matter. If you have sort of a book or, you know, if you want to type it up somewhere, and it's almost like if you've seen something really important, or if you've observed a doctor speaking to a patient in a certain way that you really liked and the skills that they used in medicine or outside of medicine, you can, if you just write about that exact experience as an example and then reflect on it then and there, just write a few bullet points, then when you come to write the personal statement, it will be a lot easier for you to remember those specific examples. So there's one or two really good examples that you can use in your personal statement to reflect. So reflection diary is what I would suggest doing if you haven't done work experience yet, or if you've arranged for work experience this summer. I'd recommend keeping a reflection diary. What you need to do is think about what you observed that day on your work experience and write 2 to 3 sentences about a key experience that sort of, you know, taught you a lot, and list 3 qualities of that individual that you observed that was demonstrated well, and reflect on why those qualities are important in medicine. And then think about whether you yourself have demonstrated those qualities, and then link that experience to why you think you'd be a good doctor. So those are the 6 steps to writing a reflection diary whilst you're on your work experience. So hopefully that helps. And when you do that, you've almost already done half the work for your personal statement, because you can literally make those bullet points of what you've written in these reflection diaries into sentences for your personal statement. So it's just to help you later on when you do come to write the personal statement. Because a lot of the time people tend to forget because they would have done experience in the summer, sorry, or the year before, and they might have forgotten. And so it's really difficult to think on the spot when you're under time conditions to write this personal statement by a certain deadline and, you know, submit everything. So doing this in advance is sort of you're making your life easier, basically. So with your work experience, like I said, this is just an example that I've written of how you can sort of reflect on your work experience. So let's go through it in a little bit more depth. So like I said, pick out some key aspects that you observed during your work experience. So for example, I've just made this example up just so you can see how you need to write in your personal statement. So something like, during my work experience, I spent time in a clinic where I observed the GP break bad news to a patient regarding their cancer diagnosis. Notice that I haven't included any patient identifiable information here. We don't know whether the patient's male or female, what age they are, what type of cancer they have. I'm being quite generic, and that's just for confidentiality purposes. So be really careful when you're discussing specific examples from your work experience if they are medical. And then what skills did you learn from it will be the next aspect to cover. So the next sentence would be something like, the GP communicated in a way that the patient had time to process the news. And then why are these skills important for a doctor? So being empathetic, and I'd write something like, being empathetic and communicating well is essential to being a good doctor, as it helps reassure and build trust with the patient. And then finally, how have you demonstrated these skills yourself? So you could give a personal example of where you've demonstrated good communication skills, and then link it back to why you feel you would be a good doctor. So that's the kind of example that I can give you in terms of how to talk about your work experience and how to reflect on it within your personal statement. So hopefully that helps. Moving on. So a main key tip, like I said, maintain confidentiality. Do not talk about do not mention any patient names, age, gender. Just be really generic and be very careful not to say anything. One thing I just recommend, if you're writing a reflection diary, not to include any personal information about the patients, just so you just completely avoid accidentally writing about it in your personal statement. Okay, next question. Why do you think you should discuss hobbies in your personal statement? So Kieran said, can you say, for example, an elderly man? Yeah, that's absolutely fine. That's fine. It's just no specific ages or, specific things about their disease that may be identifiable. But yeah, elderly man's fine. To show that you do more than school, yeah, definitely. Any other reasons why you should talk about your hobbies? Yeah, well-rounded, balanced person, perfect. Yeah. So what they want to look for is, if you do become a doctor, will you be able to establish a good work-life balance? Because if you don't, you can get stressed and burnt out very easily, which means that if you're burnt out, you might not be making decisions with the right mindset, or you might not lose motivation for the job. And as a result, you might be putting patient safety at risk. So what they want to see is, do you have a good work-life balance to be able to manage with the stresses of this career? So you will see, Elizabeth said, you will seem one-dimensional if you don't. On the other hand, if you're doing your hobbies are med-related, then it shows initiative as well. So yeah, with your hobbies, I'll come to that medical-related versus non-medical related in a second. Okay. So there's something, I always split it into supracurriculars, and then I'll talk about it later, extracurriculars, which is what most people would have heard of. So supracurriculars are hobbies which are in some way related to medicine or academics. So this could be, examples could be attending student conferences, learning medical content, if that's what you're interested in. So things like anatomy, dissection, reading research papers, if that's the kind of thing you're interested in. Work experience counts as a supracurricular activity. Any medical related volunteering, so if you do things like St. John's Ambulance and you're trying to learn first aid, that would be a supracurricular activity. I don't know if some people at school, when I was at school, we used to do something called Young Enterprise, which was a business project, but it was an academic based project where you design your own product and then you sell it. So that again would be a supracurricular. If you've set up a medical club at school, or if you're part of a medical club, or if you went on your gap year, what sort of work experiences did you do there? So those would all be considered as supracurriculars. The second part of your hobbies would be your extracurriculars. So these are activities which are done outside of academics and done outside of medicine as well. So this would be things like, if you're part of a sports club, if you play a particular musical instrument, or if you're part of the school orchestra, things like Duke of Edinburgh, if you're interested in reading, or if you're interested in community work, so volunteering at churches or temples, if you're involved in a part-time job like tutoring or any other part-time work, those will also be considered as extracurriculars. And then finally, your conclusion, like I said, you're going back in a full circle to again talk about why you want to study medicine. So you would reiterate why you wish to study medicine, but don't go into too much depth because you've already done that in your previous paragraphs. You're just writing 1 to 2 summarizing statements again, similar to your introduction. And then you're discussing why the skills you have would make you a good doctor, just to re-emphasize to them why you think you'd be a good doctor and why you deserve a place at medical school. Okay, so before I go on to top tips, there's a few questions in the chat, so let me just address those. Can we add blogging here? Yeah, anything is fine if you're interested in sort of writing or blogging, and if that's taught you certain skills that then you can relate to medicine, or his, or just anything you can, or if you think blogging is a way for you to relieve stress, anything can be included, and so that's absolutely fine as well. So top tips for your personal statement then. The things that you should do is show your passion in your personal statement and write lots of drafts and ask multiple people to check them. But at the same time, don't go overboard, because if you ask too many people and all of those people give you different things to work on, it might end up being somebody else's personal statement and not your own. So make sure to pick the right people to check your personal statement drafts so that they can give you good feedback, and then also suggest what else you could have added that you might have missed. Try and show your strengths. It is, a lot of people find it difficult to try and show off a little bit about, like, what kind of skills they have, and find it hard to find the balance between showing your strengths versus seeming really arrogant. So I think it's important, that's why, to ask other people to check your work and make sure that you're showcasing all your skills and you're giving yourself an equal chance against other candidates, but at the same time not boasting about things too much, if that makes sense. And then ask for feedback from those people as well, and be consistent. Because you can only submit one personal statement for all your 4 medical UCAS choices, medicine UCAS choices. Don't aim your personal statement at just one university. Make sure to be a little bit more consistent in general. In your personal statement, make sure not to lie or exaggerate what you've done, because they will ask about it in interview, or they will cross-check your application. Don't go into too much depth, because a personal statement, again, you only have 4,000 characters. You do need to be specific about the examples you pick, but then you also need to leave some room for them to be curious about what you've said in the personal statement, which you can then discuss in interview if they invite you for an interview, if that makes sense. Try to avoid making spelling and grammar errors. So usually on Word, you can ask, Word will check it for you, or you can use spelling and grammar like checkers like Grammarly and stuff. And that's again why you do lots of drafts, to make sure that you don't have any of those spelling errors. And don't leave it to the last minute, because it does take a lot of thinking and planning before you can get everything down on the paper. So finally, on a scale of 1 to 4 now, it's the same question as I asked in the beginning. How much do you know about writing personal statements now after I've given the talk? If everyone could just type in the chat for me. Okay, perfect. So most people are saying 3s. If you have one person saying 4, which is great. Right. So these are just some useful resources. So the 6med personal statement, there's a link which just shows how to sort of structure a personal statement, which 6med have written. There's also the UCAS website itself. They've given some tips and tricks on how to write your personal statement. And then also this other link which shows you how to write a powerful personal statement and helps you structure your personal statement well. So thank you. So that's the end of the session. So I'll open the floor to questions now. I can see there's a few people who've already asked a few questions, so I'll start answering those. If anyone else has any questions on personal statements or anything medicine related, feel free to ask them and I'll try and answer them. Okay. Someone said, so Elizabeth has asked, interestingly, I've heard admissions officers say to not say for the longest time or since I was young. Is that true? Yes. So I think for the longest time, it's a very generic statement to say something like, for the longest time I've always wanted to do medicine, because 500 other people could have said the same thing. I think what I would start with saying is give a general statement about why you think medicine is important to you, and then go into the reasons. So I would almost like make it like a story. So like I gave an example earlier, if it was that you really enjoyed learning about the heart in biology, and then you went and did some research at home by yourself, and then you found that you can do some work experience in the cardiology department, and then when you did that work experience, what you learned from there and why that increased your interest in medicine. So do you see I'm painting a story from where you started up to then what the other steps you took in order to explore that option of medicine. So that's kind of what you need to do. Someone else has said, will work experience in a private practice look just as good as work experience in a hospital? Yeah, work experience is work experience, doesn't matter. The main thing about that's why I say it doesn't even matter if the work experience is non-medical related, because it's what you learn from it and what skills you got from it, what you observed and what you're able to reflect. That's what they want to see in your personal statement. Someone said, will you be able to check my personal statement? So not me specifically. So we open these personal statement drafts, which you can submit. It's through the SIXMED website again. And what you can do there is you can submit your personal statement draft, and then you should get it. There's a group of us who mark the personal statement and then give feedback. So you have to do it through the SIXMED company, if that makes sense. Okay, next question. What's the difference between an undergrad or postgrad statement? Not much. I think with a postgrad statement, you need to talk about the additional thing that I would also talk about is how did your undergraduate degree, your BSc or your master's or whatever it was, how did that help you? How did that help you in general? What skills you learned from there, and how can those skills be applied into medicine? And yeah, so that's the additional thing that you would need to add if it was a postgrad statement. And then Miriam's asked, is 4,000 the character limit? Yes, it is. It's the maximum limit. Anything after that, the interviewers won't be able to see on your personal statement, because it will get cut off by the UCAS website. So be really, really careful with word counts and character counts. It's the absolute limit. Does a lack of work experience limit your chances of getting to university? No, because they do understand how difficult it is to get medical work experience, especially during the pandemic. But if you've done other things outside of work experience, so if you've read a lot of research papers, or if you're interested in a certain disease and you know a lot about it, talk about that kind of stuff and say you've read a lot of medical papers. One thing you can talk about is COVID, how that's impacted you. Maybe that was one of the reasons which made you pursue a medical career, because you saw the way the NHS was working during the pandemic. So yeah, it doesn't matter if you don't have the work experience, because they do understand how difficult it is to get it. But I would try my best to get something, because it makes your life easier when you're writing the personal statement and in your interviews, if you have those experiences to talk about it. But if you don't, that doesn't put you at sort of a lower level compared to someone who does have it. Will you share these slides in the SIXMED W group? So the slides should be emailed out to you, or you should be able to access it through a shared drive, I think. I will double check with the SIXMED team, but you should be able to access that and the recording as well. And then someone's asked, should we address why choose to study medicine and not another health-related discipline? I think that's more of an interview question than it is a personal statement. But for the, I can see why you asked that question. So for the question, why do you want to, why did you not pursue nursing, for example? Or if you make a statement saying the reason why I want to study in medicine is to help people, then you have to be specific about what type of help you're giving to that patient. So with doctors, you get to make decisions on their diagnosis, their treatment plan, and you go through the whole journey. Whereas with some other healthcare roles, you might be looking after the patient, but you won't be directly involved in making the treatment decisions, if that makes sense. So that's the difference between being a doctor and doing other healthcare related stuff. So I wouldn't address it directly in your personal statement, as you already have a limited number of characters. But if your reason is going to be helping people, then say how you're going to help people, if that makes sense. How to make things flow better. You can use something called linking sentences. So this will come with the more you practice writing your personal statement drafts and editing them properly. So linking sentences, use this in English as well. You'd end the paragraph and you would say why you wish to study medicine, and then you will add a linking sentence which links that paragraph to the next one. So that's how I'd try and make things flow better, if that helps. A few more questions. Someone's asked, do virtual medical rounds count as medical experiences? Yes, it's what you learn from those virtual medical rounds, if that makes sense. Because going on rounds, on board rounds, sorry, there's certain types of skills, so being quick on your feet, organised, and sort of trying to understand how the team works. Those are the kind of skills you learn while you're on board rounds. So if you're able to talk about that and what skills you learned from that, yes, that's absolutely fine. Can you write about medical shows you've seen? Wouldn't recommend it, because a lot of the time medical shows can be inaccurate, unless it's things like 24 hours in A&E or something. That's quite accurate. But I'd prefer to go down the route of talking about personal work experiences that you've had rather than medical shows. I wouldn't recommend that. Should we address why choosing to study medicine and not another healthcare? I've already answered that question. Do you write a separate personal statement for your 5th uni option that's not medicine? No, you can't. You only get one personal statement for all of the universities you're applying for. To be honest, a lot of the people, I know the 4 choices of medicine and one has to be non-medical related. A lot of those universities, when you're giving your application, they know that you're applying for medicine, and they will still give you an offer, which will be your backup offer, but they do know that you're waiting for your 4 choices of medicine. So don't worry about that. That's absolutely fine. Oh, Elizabeth's answered that. Perfect. Okay. In my locality, I don't have any chance for volunteering or work experience. Can I do online stuff? If yes, what kind of online volunteering can we do? Please share some links. I don't have the links with me now, but I can type the websites names, sorry, so that you can have a look yourself. So let me do that now in the main chat. It's a virtual work experience done by Brighton and Sussex Medical School. So that's that one. And then there's an online GP volunteering that you can do as well. If you look at the MSCAA website for work experience, they should give you recommendations, because the MSCAA is all the universities collected together, and it's the admissions team deciding what sort of work experience you can do. And they have a website where they give you sort of recommendations of where you can do online work experience. So if you look at those two, that should help. Using complex or technical words in our personal statement versus using simple language, which one of these makes personal statements better? If you mean by complex, if you're using complex and technical words, you need to be able to understand them and use them in the right context. Don't just use them because it makes you seem like you're really clever. I would stick with simple language, but if you're going to talk about a certain disease where you have to use technical language, make sure you understand what it all means, because they might ask you about it in your interviews. So would I just have to send my 5th option as medicine-based personal statement then? Yes, yeah. For example, I had 4 medicine choices and my 5th choice, I applied for chemistry. I still got the offer, but they knew I was waiting for my medical offers. So yes, it would still be the same personal statement. Any other questions? Anything else anyone wants to ask? It doesn't have to be personal statement related. It can be any part of your medical school application if you're worried about anything. I'll just wait a few more minutes if there is any other questions and then we can log off. Oh, someone's got a question. How can I prepare for the BMAT? Oh, so actually, there is a session just like this surgery session. These surgery sessions we run every Sunday from 2 to 3. There's another session on BMAT. Let me find out when it is. Right. It should be in a few weeks' time. I'll double check and I can post that in the group chat for you guys. We have a BMAT session on how to sort of go through the BMAT. The next week's surgery session will be on how to prepare for the UCAT, which I'll be running. The week after that is the BMAT session, and how to revise for that. So if you come along to those, that should help as well. Other ways to prepare for the BMAT, there are lots of books for going through lots of questions. BMAT usually tests your GCSE science and maths knowledge, so just doing lots of questions and doing questions under time conditions helps. Okay, how do we get references? So references should be done through your school. If you're a postgrad, for example, you can ask one of your lecturers who you're really close with, or a personal tutor. And if you've taken a gap year, you can go back to your school and ask them for references. And it's usually from a teacher that you need 2 references, and it will be from a teacher, 2 different teachers. Megu's asked, when is the right time to start writing a personal statement? So your deadline for, if you're going into year 13 and if you're going to apply in the 2022 to 2023 cycle, so this coming academic year, your deadline would be the 15th of October 2022 to submit everything, your entire UCAS application. So I would say start writing at end of August and have that whole month of September where you can, and the whole month of September, so you can write multiple drafts, get them checked, get enough feedback so that you're ready to send it by mid-October, if that makes sense. Perfect. Next question. So is 2 the maximum number of references, or can we get them from doctors who we've worked with, or employers as well? Employers and doctors, yeah, that's fine. But the only thing with doctors, you might have only known, it depends on how long you've done the work experience for. If it's 1 week of work experience, I wouldn't recommend getting the reference from them because they don't know you well enough. It's usually people who've known you for a few years and who know what you're like, who write these references. But if you've worked with them for a few months or, a year or longer than that, that's absolutely fine. And 2 is the maximum number of references, yeah. Any other questions? I'll stop sharing my screen as well. If anyone else has any other questions, feel free to ask them. Otherwise, I'll stop the recording in a few minutes. And we can all head off. Okay. Any book recommendations that will help me with medical school preparation? What do you mean by book recommendations? Do you mean specifically for UCAT, BMAT and stuff like that, or do you mean medical books that doctors have written? That too, but also stuff that will inspire, books by doctors or in general. UCAT and BMAT, for those, there's like a book that everyone uses, which is called 600 Questions for the UCAT or BMAT, which you can find on Amazon. Personal statements and stuff, I wouldn't recommend getting a book for that. You know, there's loads of resources online, so that'll be fine. Same with UCAT and BMAT, you don't need to get a book. There's lots of online resources that you can practice questions on, things like that. And remember that the UCAT especially is an online exam, so practicing is using online resources might actually help you in the long run. And medical books by doctors, you might have already heard of This Going to Hurt by Adam Kay, because it gives you a realistic view of what medicine is like. There's also another one called The Man Who Mistook His Wife for a Hat by Oliver Sacks, which is a really good book as well. It's quite difficult to read, but it's a really good book. It's just a long book though. And yeah, those two are the main ones I would suggest. Any tips on preparing for questions on medical ethics? Oh yeah, okay, so medical ethics, very difficult sort of MMI station. A lot of students struggle on it. There is, if you have a general structure, but there's a general structure which you can follow, and if you follow that, you can pretty much answer all of the different ethical dilemmas and questions they may ask you. You need to know the 4 ethical pillars, so beneficence, non-maleficence, autonomy, and justice. So those are the 4 ethical pillars. And for any ethical scenario, you won't be able to use all 4 of those ethical pillars, but you'll be able to use a mix of them, like 2 or 3 of them, to argue your ethical scenario. So learn the 4 medical pillars, ethical pillars, sorry, is what I would say, and understand the rules around confidentiality and consent. So those are the 3 main ethical things that they expect you to, it's something that you do have to learn, you don't get taught it in school, and it's something you have to spend some time learning. The Medic Portal is a good website for that, 6med is a good website for it. And then if you just search online about how to answer medical ethics questions, there's specific structures which you can follow, and it's just about knowing the common ethical scenarios they may ask you about. Abortion, they could ask you about euthanasia, HIV patients and confidentiality, or like young girls asking for contraceptive pills. Those are really, really common ethical scenarios. Or they might ask you a question like, we have 1 liver, but that we can give as a transplant, but there are 2 patients, and then they'll give you some information about 2 different patients, and they'll ask you which person should deserve the liver. And you need to do an ethical argument about who you think the liver should go to. Another one is whether or not there might be a patient who's losing a lot of blood, but they're a Jehovah's Witness, so you can't give them a blood transfusion. What else can you do? Those are the kinds of ethical scenarios they'll ask you about. And knowing those principles, the 4 ethical pillars, and issues around confidentiality and issues around consent will basically help you answer any of those scenarios. So I hope that answered your question. Any other questions before I log off? Oh, someone said feedback, first time attending 6med surgery is just amazing, so helpful, thank you so much. No problem at all, and hope to see all of you at other 6med surgery sessions as well. And I'm glad you find it helpful. Miriam, do you have to pay for each uni application? No, it's just one payment. I think it's about 30 or 40 pounds, I can't remember. It's been a while since I applied, but it's one payment which you will pay just before you submit the UCAS application for all of your choices. So yeah. All right, thank you everyone. If you don't have any other questions, feel free to go and enjoy the rest of your day. I'll just stay on the call in case anyone does want to ask me questions, you know, without loads of people in the Zoom call as well. Yeah. but feel free to leave if you don't have any other questions. I've got 5 more minutes. If any of the students who are remaining, if you have any other questions that you wanted to ask just on your own and you didn't want anyone else listening to your question, that's absolutely fine as well. You can ask them now. I missed the answer. Can you say it again, please? Yes, Miriam, let me go back to your question. What was it? Do you have to pay for each uni site application? No, you don't. When you submit your application for UCAS for all 5 of your universities, sorry, you pay one fee of, I think it's about £30 or £40, I can't remember, but you can double check that on the UCAS website, and it's just one payment for all of the universities. So hopefully that made sense. And do you have to apply to 4 unis or just one? So the way the UCAS works is you get 5 choices and you have to apply for 4 medical universities and 1 non-medical university. So that's how it works. I'm not sure if you're applying, so I don't know what your situation is. So if you're applying from a different country, I'm not sure how it works. I'm not sure if you have to apply for 4 universities, but usually in the UK with the UCAS cycle, that's how it works. So that's how I'd assume it would work, even if you're an international student. You would apply to 5 different universities, 4 of them being for medicine and 1 of them being for a medical related degree, but not medicine. Okay, perfect. So if there are no other questions, I will log off now, but thank you all for attending and hope you have hope you have a good rest of the day. Oh, someone's asked, do universities have access to our BMAT results? Yes, so it will be directly sent to them. Once you've done your UCAT and your BMAT, so UCAT, you will find out your result immediately after you've done the exam, and then you can apply to universities based on the score that you got to maximise your chance of getting into those universities, depending on how much weighting they put on the UCAT, which will vary from one uni to another. BMAT, because it's done on a set date in November, usually the first week of November, your results go straight to them. Your UCAT results also go straight to the universities. Any final questions? 2 more minutes. Okay, I think I'll end the session there. Have a good rest of the day, guys, and hope the session was helpful.